Hi, so with another update for you across Bristol about what we are doing in the face of COVID to keep everyone safe. So it's a year since Bristol registered its first confirmed case of COVID-19. Since that time, 500,000 tests have been taken, 29,500 positive cases recorded. We really appreciate your efforts to protect lives, to help the vulnerable, limit the spread of the virus and support each other during that time. It's been a real source of city pride for me and so many others. Through the Can Do Bristol website, we've had over 4,000 people pledge to help their communities. Around 3,000 vulnerable residents have been supported with things ranging from befriending to collecting shopping, prescriptions, dog walking. This pandemic has been a challenge for all of us, but the biggest challenge has been around those vulnerable people in our most vulnerable communities who've been hit the hardest. And thank you all for stepping up to support each other. From Monday, schools and colleges are open for all students. Recreational exercise outdoors with household or one other person is allowed, but there remains no household mixing indoors. Please check our website, bristol.gov.uk, or the government website, gov.uk, for more information on these changes. And I know many of you will be looking forward to the coming months as restrictions begin to ease, but please be patient. We must not be prematurely overconfident. I described this earlier on like being in a marathon, and we're at mile 18. We've done a lot of hard work, and let's not sprint too early, all right? We still have a ways to go before we can actually really release us from the restrictions. For those who are continuing to struggle, and we know there will be many, support is available through the We Are Bristol free helpline called 0800 694 0184. It's open Monday to Friday, 8:30 a.m. to 5 p.m. and Saturday and Sunday, 10 a.m. to 2 p.m. If you need immediate emotional and practical mental health support, call 0800 012 654. And this is a 24 hours a day, 7-day a week helpline. But yeah, please take care and stay safe. And thank you for just holding up over this last year. As of yesterday, our case rate was down to 82 new cases per 100,000 people in our population over the last 7 days. Again, we're going down, we're going in the right direction. This is just below the England case rate average of 91. Our infection rates in Bristol are still high, however. Like I say, it seems like a lot of progress, and it is, to come down from the 400s, but we're still in the high double digits. We're not clear yet. South Gloucestershire Council have continued to offer additional community surge testing. They are searching for a new variant of concern in the area, commonly known as the Manaus Brazil P.1 variant. The risk to the general public is assessed as low. The additional testing is highly precautionary. People who live in Bristol but who work or have to visit the postcodes in the surge testing area can get a one-off test. And you can find out more about this on the South Gloucestershire Council website, so please visit. But we have had fantastic cooperation between ourselves and South Gloucestershire through our public health teams, and long may that continue. The Southwest is one of the best performing regions in the UK for vaccine rollout. Over 100,000 people in Bristol have already had one dose of the vaccination. As we move through the priority groups, it's important that you wait to be contacted before booking your vaccine. Please be patient, be kind, don't worry, your turn will come. And as I stressed throughout, it's really important that we're gracious with each other during this period of time, but other members of the public, but also the professionals who are having to roll out the vaccine, manage the surge testing, and medical staff, retail workers. We just need to really, as we all are in a state of tiredness and weariness with this, we need to be gracious with each other and keep each other up. Unpaid carers are a group that have been identified, and now the vaccine to those groups has started rolling out. They're being contacted by the National Health Service for their first jabs. Unpaid carers are those people who are eligible for carers allowance, or people who are the sole or main carer of an elderly or disabled person who's at risk of COVID-19 mortality, and is therefore clinically vulnerable. So to be eligible, carers must deliver personal care to the individual at risk. This does not include, for example, shopping or cleaning only. But if this is you, your GP or council officers will contact you if you deliver personal care to an at-risk person, but are not registered as a carer or are not eligible for carers allowance. You will also have the opportunity to be vaccinated. Don't be concerned if you don't hear immediately or have to wait a short while to book.